Let's start with the heat illness. So in heat illness, we have many things. We'll go according to the Harrison. Okay. So in heat illness, we have like heat edema. Okay. Then heat exhaustion. Okay. Then heat syncope, heat stroke. Heat stroke is most fatal form of all. Out of which there is one more thing. There is malaria rubra. Okay. That is nothing but a skin lesion that occurs when you have a lot of when you have exposure to the sun. All right. So we will start with what are the ways of heat dissipation. Okay. So how the heat gets in like how is the normal metabolism of the heat in the body, right? Then we will go on to discuss each individual thing. We will first discuss about the risk factors. Okay, so Harrison has given big table on that fact as well. Then risk factor, then coming to the clinical features of each individual disorders, which I just told illnesses, and then coming to the cooling methods. Okay, so where we'll also discuss about the resuscitation methods, right? So this is about the overline or outline of this topic. So let's start. All right. So our body's normal temperature is around 37 degrees Celsius. But as I've already told, this is the spectrum. Heat syncope, muscle cramps, heat exhaustion, okay, and heat stroke. It's a medical emergency, obviously. So our normal body core temperature is to be maintained by the thermoregulatory system. All right. So normal temperature is around 37 degrees Celsius, but the serious trouble begins when the temperature goes above 41 to 43 degrees Celsius. All right. Then what is fever? So fever is nothing but the intact thermoregulation. That means if I am having fever, that means my all the integumentary system or my all the thermoregulatory system, my hypothalamus, had set my temperature point at lower point, and that's because of that I will start sweating or I will have fever. And again, if the hypothalamus sets it little lower, I'm having sweating to resolve that. Okay, that is the normal thermoregulation. All right, but whenever this normal thermoregulation gets distorted, so it can be getting distorted in the many cases. For example, if patient has excess of dehydration, he has excess of workout. All right. So in such cases, you will see thermoregulatory failure, which can lead to the heat stroke. So this is about the concept. Now, what are the methods of the thermoregulation? So the first thing is heat generation. All right. So whenever you do strenuous exercise, this can increase the heat production 20-fold, almost 20-fold. All right. So what is central thermostat? That is located into the preoptic nucleus of the anterior hypothalamus. All right. And the efferent signals that is given from this are that triggers the cutaneous vasodilation and sweating for heat loss. All right. So this is how is the mechanism. First is heat generation, whatever may be the cause. For example, exercise or somebody is having some sort of bacterial infection. Then your central thermostat act in such a way, and then efferent signals by the cutaneous vasodilation and the sweating for the heat loss. All right. So this is about the thermoregulation in a nutshell. Now, what are the mechanism of heat dissipation? So there are four common: evaporation, radiation, conduction, and convection. What is evaporation? Evaporation means that get evaporates, right? So it is the most efficient mechanism of the heat loss. But remember, whenever you have humidity, so as I mentioned over here, whenever humidity is there, it becomes ineffective. And how much humidity? More than 70% of the humidity. Okay. So in very humid environment, you will not see evaporation, and that will keep you little more warmer. And that's why the people say that in the coastal region, you'll feel more heat. Okay. So it's because of the same reason. All right. Then radiation. So second method is of the heat dissipation is radiation. So our skin will radiate some of the heat, and that's why they say wear lighter clothes in the heat. Also, that occurs because of that helps us to prevent heat from the radiation and convection. All right. So radiation is also one method. The heat will get evaporated or radiated. Or third thing is conduction. So direct transfer of the heat to the cooler objects can also occur in due to the conduction. All right. Then coming to the convection. So convection is by the air currents. Okay. So loss of the heat by the air currents, and that is the only mechanism you use in the fans and air conditions. Okay. So it becomes ineffective when the environmental temperature exceeds the skin temperature. All right. So what are the certain factors that risk for the heat illness? So these are some of the factors, and the table is also given from the Harrison. I've also added that. So we will discuss that. So here we have, first of all, if you are too sweaty, that means dehydration is there, tight clothing, dehydration, high humidity, okay, which we already discussed. All right. Then very important to know that water has a very high conductivity, almost 25 times more than the air. Okay, that's why it increases the air loss, heat loss that occurs in your, for example, if you are sweating so much. So that is the reason behind that, because water conducts the heat most of the times. Okay. Yes. Now coming to the this summary of the table: evaporation, radiation, conduction, convection, and peripheral resuscitation. All right. So here are some of the factors that I already told you. So not going into this will only help you to revise whatever stuff we have already discussed. All right. So this is about the mechanism of the heat dissipation. Okay. So the most common is evaporation, and but it is not effective in the humid environment. That's it. Now, there's one more concept that is called as acclimatization of the heat. So whenever you go into, like we discussed in the acute mountain sickness, right, that you have to do acclimatization in that environment, but here also you have to do acclimatization, and that typically occurs after the period of 1 to 2 weeks. All right. So how does that occur? First is lowered sweating threshold. Okay, increased plasma volume and lowered heart rate. So in that way, so if you lower the sweating threshold, that will prevent the salt concentration, that will keep more and more amount of the water in the body, and you will not get dehydrated easily. Okay. So lowered sweating threshold, increased plasma volume has a effect, and lowered heart rate. Okay. Then what is the deacclimatization? So it occurs within a weeks after leaving the hot environment. Right. So this is about the acclimatization concept. The only thing you should know is for 1 to 2 weeks period is required for that. Right. Okay. Then precipitating factors and the differential diagnosis. So this is the table that is given in the Harrison for that. So for various, for example, if you're talking about the cardiovascular insufficiency in the heat-related illness, okay, so that will typically occur in patients who are age extremes. Okay, so younger, very young, or very old patients. All right, if patient is on beta or calcium channel blockade, that can also affect the vasodilation in this patient. All right, and that can affect the heat dissipation. Then congestive heart failure, where already there is no enough amount of the action of the heart, so it will definitely trigger the cardiovascular insufficiency in this patient. Then dehydration, diuresis, obesity, poor physical fitness. Okay, so remember these are some of the predisposing factors for cardiovascular inefficiency in case of heat-related illness. Okay, then coming to same central nervous system illnesses, impaired. Then central nervous system we have cerebellar injury, cerebral hemorrhages, hypothalamic cerebrovascular accidents, then psychiatric disorders, status epilepticus. Okay, so these are some of the high risk factors that you should know that can trigger the CNS illnesses. CNS illnesses in case of heat related illness. All right. Then impaired heat loss if you are on certain medications, for example, antihistaminics. Okay. Then heterocyclic antidepressants, occlusive clothing, and skin abnormalities. Okay. So I hope you're getting it that what we are talking about the predisposing factors. Okay. So if there is an impaired heat loss, it can occur because of this many conditions. Then endocrine and immune related illnesses will be in the form of decay, multi-organ dysfunction, pheochromocytoma, SIRS, thyroid storm. So in all these conditions, that may trigger the endocrine as well. Okay, similarly, excessive heat load can get triggered in the form of if there are like very humid environmental condition, then exertion is there, patient is having fever already, hypermetabolic state like hyperthyroidism or pregnancy is there, and lack of acclimatization. Patient has recently moved, then this can occur. All right. Then infectious illness, again, if patient already has this many infections, can trigger the infectious illnesses in this patient. All right. And finally, toxicological illnesses. So if you have taken the patient of like amphetamines, anticholinergic, if patient is taking any of this, that can trigger the heat generation and can trigger the heat related illnesses in such environment. All right.